So in the health space, which obviously is where I spend a lot of my time focused, and I know you do as well, the term social determinants of health is something that's been around for a while, but I think people are really starting to more seriously embrace that. You know, the notion, as I understand it, that the health of a population or the health of individuals are influenced by a lot of things other than actually doctors, drugs, devices, you know, sort of hospitalization, surgeries, that a lot of different things, the quality of our air, the environment, the schools that we go to, how safe our streets are, really impact the health of populations. And it seems to me as such, there's an attempt to really link that through data. So wondering if this broad area of social determinants of health is one that fits with this evidence, the impact collaborative and the data issues you're talking about.
Most certainly. So the concept of social determinants is kind of course been around for a while, and is really, I've seen them kind of most successful work in particularly these highly interdisciplinary spaces. It really demands it, if you will, to reach across and out of kind of traditional academic silos. And so there's a lot of opportunity in that space. Again, it comes from, you know, access and availability of data, because it can be very difficult to capture, particularly, you know, over time, over large periods of time, how these kind of factors are at play. Often, you know, in survey work, we often end up having to rely on, you know, retrospective accounts and things like that. And so this is one area where administrative data really does shine. It gets kind of, you know, in kind of, you know, real time, or at least prospective kind of accounting of what was going on. It's that snapshot at least, and then time continues. And when we come back and we look at that data, we can often see, you know, a lot of what has been theorized. It's been so important about social determinants of health. And, you know, what I've, coming as really a child development and public finance kind of background, I've been really excited to see, for instance, opportunities to work, for instance, with our business school around housing related issues, or with folks in our economics department around labor and migratory related issues. And that's been particularly, you know, exciting. One of the things that the Social Science Research Institute started, I guess, maybe 2 years ago now, and has made some hires, was a cluster hire in this space, the social disparities space, that has really bridged a number of different colleges. And those researchers, we find, often have a natural kind of interest in using a lot of the data that the Evidence Impact Collaborative has been working to curate and make it easier to access. So that's been, you know, particularly reinforcing. I too come from that health, that kind of health background, and so to see the kind of interest in thinking not only about our healthcare settings, but also what families, what children, what individuals across the lifespan are engaged in, what they're doing outside of that kind of clinical setting has been so powerful. Great.